So when you look at the heart model, we have a few structures that I'd like to point out too. First of all, we have on the bottom, we have the heart and the apex of the heart, where it comes to a more pointy point. And then the top is the base of the heart. We have on top, the top portion, we have two atria, the four chambers, and in the bottom portion we'll have two ventricles. We can open the flaps, we have the atria on top and the ventricle on the bottom. Here's on the right side, and here's on the left side. Then we have interventricular septum, one in the front, an anterior one, and when we turn the heart around, we have a posterior one, also this one. And then in the posterior one, we can easily and nicely also see the coronary sulcus. When we look at the vessels that come out of the heart, we have for the arteries, these are vessels that feed the heart. We have a right coronary artery and a left coronary artery. They both come out of the base of the aorta, the ascending aorta. The left coronary artery is just not visible, it's behind here, the pulmonary trunk. When we take the left coronary artery, and the first offshoot of it is the anterior interventricular branch of it, and then it feeds into what we know as the circumflex artery. When we look at the right coronary artery, we have the right marginal branches coming off of here. And then when we turn it around, the heart, we have in the back a posterior interventricular artery that's coming out of the right side. When we look at the veins, I want to stay in the back first because I want to point to the coronary sinus back here. It's a little bit of an enlarged part. The coronary sinus has a hole that goes into the right atrium. Since it's used up a lot, we want to feed it into the right atrium going into the pulmonary circuit. We have a few things that feed. We have a posterior interventricular vein, which is right here, that feeds the coronary sinus. We also have a middle cardiac vein that feeds the coronary sinus, and we have a small cardiac vein. They all go into the coronary sinus and into the atrium. And one more vessel that goes into the sinus is the great cardiac vein right here. We do have multiple anterior cardiac veins, and they feed directly into the right atrium. They don't have to go all the way around into the coronary sinus. When we look at the vessels that, the great vessels that feed into the heart and come out of the heart, we have a superior vena cava right here, and an inferior vena cava feeding into the right ventricle. Then we go from the right ventricle into the right atrium. Let me make that open. And we go out, feeding into the pulmonary trunk. Pulmonary trunk will go into the right and the left pulmonary artery. When we finish getting our blood oxygenated from in the lungs, we come through the pulmonary veins. They're on the side here, both sides, and they feed into the left atrium. We're going to go back into the left ventricle, and as we come out here posteriorly, we feed into the ascending aorta that feeds into the aortic arch, and we go down the descending aorta. The three stumps we get out of here is the right brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. Let's look at the internal anatomy a little bit of the heart. This is the right atrium. We have multiple connections coming in, but one of the things we also see in here is this little indentation, and that's the fossa ovalis. From the atrium we go through the right atrioventricular valve, and that's also known as the tricuspid valve, into the right ventricle. Tricuspid meaning 3 flaps, and then chorda tendineae attached to it, and the chorda tendineae feed into papillary muscles. The rest of the structure down in here that has interlaced muscle tissue is known as trabeculate carne. As we exit the right ventricle, we exit through the pulmonary semilunar valves out of here. We're going to have the same thing on the left side. We have an AV valve, also an atrioventricular valve. This one only has 2 flaps, so we call it the bicuspid valve, or we can also call this the mitral valve. And the semilunar valve is considered the aortic semilunar valve because it goes right into the aorta. Note that not on the model as much, but in real life, the right heart wall is much thinner than the left heart wall because we have to pump the blood to the whole systemic circuit on the left side versus the right side only needs to go to the lungs and back.